Here's another thought as it's coming up to Christmas. Wearable technology gadgets. Are they just another trend or fad, or are they here to stay? As usual, I've done a bit of research. A lot of the figures here are generated from USA, so some of that needs translating and converting to GBP if you're watching from the UK. Wearable Technology 2025 is reportedly a $219 billion industry. So we're asking the question, are these fitness trackers and smartwatches and biohacking devices worth the money that we spend for them, or are they just another expensive fad? I'm going to look at the science behind this as well. And all the references I'll put in the notes to this podcast rather than reading them out. So welcome to Peace Unplugged on this rather cold December afternoon, hence my rather unusual apparel today. As usual, I'm addressing some key issues around health and well-being. So this Christmas, as is usually asked by my wife or my family, what do you want for Christmas, Martin? Something I always struggle to reply to. However, I was just thinking about these like wearable technology things, these gadgets. Always been a bit of a fan of gadgets as it happens. They have been a bit of a consideration, and it got me thinking, are these so-called biohacking devices and gadgets, are they really useful? Can they help improve our general health? Or they are just going to be another expensive item bought for us and just end up in the drawer alongside those dead batteries and obsolete cables, old mobile phones, random screws, and as I once found, a pair of broken scissors. Current adverts on social media seem to be exploding all about this wearable technology. Really quite fascinating and rather tempting. The research I've made talks about a market valued at around £219 billion in 2025, projected to reach nearly $500 billion in 2030. That's from your Apple Watch, the Oura Ring. It appears these devices promise us to have a real understanding of our body, but there's an uncomfortable truth. About 30% of users abandon the smartwatches within 6 months, and engagement drops to around 16%, and that's after 320 days. So you've got to ask the question, what's going on here? Are these devices genuinely changing healthcare? Or are we just paying an awful lot more money to feel even more anxious about our sleep scores? I've researched 5 areas around this with some scientific backup. The references, as I said, will be in the notes. Let's see whether these things are really worthwhile. So the first thing to look at is the accuracy question. When you strap on a, say, £200 smartwatch or slide on perhaps a £300 ring onto your finger, you're making an investment based on one fundamental assumption, that the device is actually measuring what it claims to measure. After all, if a fitness tracker says our heart rate is 72 beats per minute, when it's actually 92, those morning recovery scores aren't just unhelpful. You could say they're actively misleading. Promise is enticing, isn't it? Real-time heart rate scores, sleep stage analysis, measuring heart rate variability, measuring blood level, oxygen. All these track continuously 24 hours a day, giving us insights that would normally involve booking an appointment at the hospital or the doctor's surgery. But here's where things, as usual, get a little bit complicated. Comprehensive systematic review published in the JMIR Health in 2024 examined wearable activity trackers' accuracy for detecting medical conditions. The researchers searched for 10 databases and analysed studies using these devices in real world. That's in free living conditions, not in a controlled lab environment. These devices, it appears that whilst these devices show perhaps a little bit of promise, their accuracy remains a little bit uncertain. And I'm not talking about minor variations. We're talking about fundamental questions of reliability. There's another major validation study I discovered, published by Sensors compared to 6 popular wearables against gold standard PSG and ECG. The devices tested included the Apple Watch Series 6, Garmin Forerunner 245, Polar Vantage V, or was that Polar Vantage 5 that I reckon that should read, the Oura Ring Generation 2, Up 3.0, and Somfit. 53 healthy adults spent a night in a sleep lab fitted with all 6 devices simultaneously. Here's what they discovered. Sleep detection, that's wake versus sleep. The results were that the devices performed reasonably well at detecting whether you were asleep or awake, with agreement ranging from 86% to 89%. The Oura Ring showed 89% agreement with Cohen's kappa. That's a recognised measuring formula. The answers to that are 0.51, while Whoop came in at 86%, with kappa of 0.44. Looking at heart rate accuracy, this appears to be where these devices work really well. Whoop demonstrated a 99.7% accuracy for heart rate measurements. The Oura Ring showed 99.3% accuracy for resting heart rate. Pretty impressive numbers, eh? The sort of numbers you want to see for medical measurement. Looking at heart rate variability, Whoop is 99% accurate when measuring HRV, with an average underestimation of just 4.5 milliseconds. The Oura Ring demonstrated 91.5% accuracy, measuring RMSSD. That is apparently a key HRV metric. Now let's look at some problem areas. The sleep stages. When attempting to distinguish between light sleep, deep sleep, and REM sleep, accuracy drops dramatically. The Oura Ring showed 76 to 79% sensitivity, precision across sleep stages, meaning about 1 in 4 measurements was wrong. For the Apple Watch, it ranged from 50.5% to 86.1%. A more telling study compared these devices' PSG, found the Oura Ring was only 65% accurate in detecting light sleep, 51% accurate for deep sleep, and 61% accurate for REM sleep. That means that nearly half the time the sleep stages are classified as incorrect. So the wearables are quite good at telling us what our heart rate is and whether we're asleep or not. The scores are less useful or considered mediocre when it comes to telling us what sleep stage we're in. And more importantly, the devices provided are based on those less reliable sleep stages measurements. I'll list the scientific references in the notes. Now let's look at how useful these gadgets are for behaviour change. What's the evidence to say they make us actually healthier? So let's assume the device that we're wearing is reasonably accurate. The next logical question to ask is, does having access to all this data actually change our behaviour? And does it do so in meaningful ways? Does knowing your sleep score actually improve your sleep? Or does tracking your steps actually make you more active? This is the real test. After all, a perfectly accurate device that doesn't improve health outcomes is just an expensive toy, is it not? The wearable industry has long argued that their devices don't just measure, that they motivate. Do they kind of like gamify your health, and that they provide some accountability? But research on behaviour change techniques in wearables reveals a more complex picture. A comprehensive review published in PMC examined behaviour change techniques, BCTs, in Internet of Things devices and wearables, focusing on their efficiency in promoting lasting behaviour change. The study found that while wearables can effectively deliver certain behaviour change techniques, like goal setting, self-monitoring and feedback, the real-world impact is heavily dependent on the user engagement. And here's where that abandonment statistic comes in. Surveys show that 29 to 30% of users stopped wearing smartwatches within 6 months. Further data revealed that engagement drops just to 16% after 320 days as the novelty fades away. Just think about what that means. For every 100 people who buy a wearable with genuine intentions to improve their health, 84 of them will have essentially given up within a year. Think about that for a moment. How many of us that make New Year's resolutions to improve our fitness, such as joining a gym, for instance, find themselves giving up after just a few weeks? And in terms of behaviour change, much of my career was involved with helping people address behaviour change, and I'll testify that it is exceptionally complicated and significantly challenging. Okay, so what does work and what doesn't work? Studies on wearables and behaviour change have identified several effective techniques. Number 1, the ability to track activity or sleep is most effective when combined with personalised insights and recommendations. Simply seeing your step count is less powerful than understanding what those steps mean for your specific health goals. Number 2, goal setting and progress tracking. Devices that allow users to set specific measurable goals and visualize progress towards those goals show better engagement rates. This is classic behavior change science. To clear milestones. Number 3, let's look at social support and competition. Features that enable social sharing, challenges, or friendly competition have shown to extend engagement. The Fitbit community and Apple Watch competition ring tap into this principle. Number 4, immediate feedback. The real-time data provides insights. These are more likely to drive behavior change. So, for instance, knowing that your heart rate spikes during a stressful meeting is more useful than reviewing it at a later stage when your heart rate is likely to have settled down a bit. Here's a paradox. Wearables work better for people that are already health conscious and have the motivation to change. They're least effective for populations that arguably need them for more, shall we say, sedentary or lazy individuals, or people with chronic health conditions who are yet to really fully understand how to manage them, or simply those that haven't yet received the education. A review in obesity medicine highlighted that while wearables show potential in personalized weight management through continuous glucose monitoring and adjustments, they work best when integrated with professional support and a structural program, not used in isolation. Then there is what we call the placebo effect. This is something that apparently has been understudied in terms of wearable technology. When users change their behavior based on device feedback, how much of the improvement comes from the actual data insights versus the psychological effect of believing that they're being monitored and measured? Researchers suggest that for many users, the primary benefit isn't the data accuracy, it's the heightened awareness of accountability that comes from wearing any tracking device at all. Again, I'll refer you to the notes for the scientific references. Now let's look at another controversial aspect, the market reality. That means following the money. It's effectively the elephant in the room, isn't it? The wearable technology market isn't just big, it's actually enormous, and it's growing explosively. We're looking at a global market valued at approximately 219 billion in 2025, this year, as we're coming towards the end of it. And it's projected to reach $493 billion by 2030. That reckons a growth rate of around 17.6%. They're not small numbers, are they? We're talking about an industry roughly the size of the entire pharmaceutical sector in some countries. Samsung, Fitbit, Garmin, Whoop, Oura, these companies have billions of reasons to keep us buying, wearing, and crucially, upgrading the devices. Here's the point. Market growth doesn't necessarily equal health outcomes. Consider this data. Smartwatches held 46% of the wearable technology market share in 2024. Yet surveys show that 29 to 30% abandonment within 6 months. The global wearable market shipped 534.6 million units in 2024, growing 5.4% year over year, according to the IDC's worldwide quarterly wearable device tracker. So if a third of those devices end up unused, are we really talking about a health revolution? Or is it just another electronics trend or fad? While consumer electronics generate 58% of the wearable revenue, healthcare applications are growing at 20.55% CAGR through 2030. This suggests that the medical community sees real value, but they're also the most cautious and evidence-focused buyers. So let's look at the take-up reality. Over 68% of wearable adoption is driven by consumer interest in health and fitness tracking. In the United States, approximately 35% of adults currently use wearable healthcare devices, while 40% use related healthcare apps. About 58% of American adults who track actively use an Apple Watch, followed by 25% using a Fitbit. Here's something else a little bit more interesting. 33% of US employees now integrate wearables into employee wellness and productivity programs. So that means that companies are investing into these products. That's employers. And they're not necessarily doing that out of altruism. Certainly in the US, they believe it's a way of trying to reduce healthcare costs and improve productivity. Early data on enterprise programs show mixed results, with success heavily dependent on program design and incentive structures. Something called the reimbursement shift. A major development. CPT codes for remote patient monitoring have been established in the United States, apparently removing billing friction and catalyzing doctor adoption. Medicare now provides major requirements for patients and wearables offering real-time data for objective home screening and apparently are contributing to market growth. So again, referring to America, When insurance starts paying for something, that's usually a signal of demonstrated medical value. That can also reflect on successful industry lobbying, as we know that goes on in America. Let's look at the regional divide on this. North America generates 32% of wearable revenue in 2024, but Asia Pacific is projected to expand at 20.8% through 2030. What's driving this? In developing markets, wearables are often the first point of contact with personalised healthcare technology. They're leapfrogging traditional medical infrastructure. This is the sustainability question. The FDA authorized 124 novel wearable devices in 2023, its highest annual total. Rapid innovation also means rapid obsolescence. The average smartwatch is replaced every 2 to 3 years. That makes for quite a lot of electronic waste. There are some manufacturers that have some recycling programs, but still the environmental impact is significant. So what does following the money really tell us? The market data suggests wearables are transitioning from consumer gadgets to legitimate healthcare tools, but it appears at the moment we're still in a bit of a transitional phase. The high abandonment rate tells us that lots of people are not that satisfied and rather disappointed. Quite often we find these devices not quite as useful as in the way that they've been advertised. It does appear that they're going to be a bit more useful in professional settings though. Now let's look at, considering what I'm wearing today, the dark side. That's about privacy obsession and the unintended consequences. So we talked about accuracy and behaviour change and the money. Now let's talk about what the wearable industry would prefer us not to know, or at least not to think too hard about. That's the potential downsides of constant monitoring. But remember, these devices involve an enormous amount of data collection. That data is intimate to us. It's about our body, it's about our habits, it's about where we live, it's about our behaviours. These gadgets know when we're asleep or when we're awake, when and how much we exercise, measure how stressed we are, and it appears increasingly they measure about our reproductive health. All that data lives on corporate servers and it gets analysed by algorithms. And in some cases, it gets shared with third parties, and that's not necessarily with our consent. A 2025 cross-sectional study published in the Journal of Medical Internet Research examined usage trends in data sharing practices among US adults. Those findings revealed significant concerns about privacy, data security, and who actually controls that healthcare information. The study noted that healthcare wearable devices can transform healthcare delivery through real-time monitoring, detection, early disease detection. However, there still persist. Significant gaps exist in understanding how socio-demographic factors, health conditions, and digital literacy affect data sharing behaviours, but that information gets a little bit uncomfortable. Researchers found that willingness to share wearable data varies dramatically based on who's asking. People are generally comfortable sharing data with their healthcare providers, but considerably less comfortable when it comes to insurance companies, employers, or third-party researchers. Yet those are the ones that are actually getting the data. In the UK, that refers to the laws of GDPR. I'm not going down that rabbit hole today, don't worry about that. Beyond privacy, there's an emerging body of literature of what researchers call orthosomnia. That's an unhealthy obsession with achieving perfect sleep data. A report from UW Medicine noted that sleep tracking apps and devices can actually cause anxiety and insomnia in some people. The constant monitoring creates pressure to perform, and paradoxically, the stress about not getting perfect sleep scores can itself disrupt sleep quality. Let's examine the documented risks and the unintended consequences. Security vulnerabilities in wearable-to-network connections pose a significant challenge. These devices are collecting sensitive personal data continuously, and the data breaches potential will compromise our security and our privacy. Let's face it, considering considerable encryption and privacy controls, these breaches still happen. We hear about it in the news, usually at least 2 or 3 times a year, in my experience at least. And that's just the ones that we get to hear about in the news. So the increased need to address data security is going to discourage us from actually using these. That will slow down the adoption rate of these devices. Here are the major concerns. Where's the data stored? That's probably cloud servers, and they're controlled by corporations. As you said, who has access to this data? Is that companies, researchers, or potentially with breaches, hackers? How is data monetized? Aggregate data sales, targeted advertising, government access, law enforcement requests, and surveillance. Some of this stuff touches on human rights, doesn't it? Apparently, the European Union responded to these concerns by approving the Wearable Device Regulation in 2025, ensuring standardized safety, and other regions though lack similar protections. And of course, those of us in the UK are no longer members of the EU, so that regulation doesn't apply. Let's look at something called the anxiety amplification effect. Multiple studies have documented cases where constant health monitoring increases health anxiety rather than providing reassurance. Users become hypervigilant about normal physiological variations. That means interpreting these sort of minor fluctuations as a sign of a serious problem. UW Medicine specifically warned that the using sleep tracking devices can have the opposite intended effect, potentially causing anxiety and insomnia. When users become obsessed with achieving perfect scores, they develop performance anxiety around sleep itself, which of course is fundamentally incompatible with trying to get a good night's sleep. There is the data user misunderstanding concept. Because many users don't understand the accuracy limitations, as discussed earlier in this podcast, they may make decisions on flawed data. Seeing a low sleep score might prompt someone to cancel important activities or make unnecessary medical appointments when the device measurement was simply inaccurate. There's something called the behaviour change backfire. For some users, wearables don't motivate healthy behaviour. They simply enable unhealthy obsession. Exercise addicts use them to justify excessive training, or people with eating disorders. They use them for calorie tracking. See, the devices themselves are neutral, but they can be weaponized by individuals, and that can cause some considerable mental health challenges. There's something called the equity and access issue. Advanced wearables cost with additional subscription per month for many premium features. This creates a situation where health optimization technology is available primarily to the affluent populations. That, of course, increases the wealth gap rather than reducing it. This dependency on technology is suggested perhaps that most concerning is the risk of learned helplessness, where users become unable to assess their own physical state without the use of a device for confirmation. For instance, I don't know if I'm stressed until I check my HRV. I can't tell whether I slept well or not until I see my sleep score. It is suggested that the outsourcing of bodily awareness to technology represents a fundamental shift in how we relate to our own bodies. So let's look at clinical applications. This is where perhaps these devices can be most useful. It's getting nice and warm in here now. I think I might let the hood down. So most of what I looked at so far has been critical analysis. And you might think that I've got an opinion that's fully against these devices. Well, I'm not as such. I think they are useful if they're used appropriately and in the right context, perhaps where they integrate into real healthcare. The difference between hype and help comes down to application. So, for instance, a consumer buying a $400 ring, hoping it will magically improve their sleep, is likely to be disappointed. It's not the one ring that rules them all, if I may make a Tolkien reference. It does have its dangers. A cardiologist monitoring a patient's atrial fibrillation risks using validated wearable ECG data is using the technology appropriately. The challenge is separating legitimate clinical applications from marketing promises. A scoping review published in PLOS Digital Health examined wearables research for continuous monitoring of patient outcomes, specifically looking at studies using devices in outpatient settings with clinically relevant measurable outcomes. The review included 80 studies, searching databases through August 2024. What they found reveals both the promise and limitations of medical-grade wearable applications. Most studies, that's 85%, use device data to monitor existing chronic diseases, while only 15% use wearables to diagnose new diseases with other medical care under well-defined conditions. Let's look at what's called chronic disease management. The PLOS Digital Health Review found that neurodegenerative diseases represented 32% of monitoring applications, with cardiovascular conditions accounting for 75% of the disease detection applications. Wearable devices help patients with conditions like Parkinson's disease, multiple sclerosis, and heart conditions. They provide continuous monitoring that would otherwise involve us going frequently to appointments at clinics, doctors and hospitals. For example, continuous remote monitoring through wearables allows doctors to track Parkinson's tremors, the gait changes, medication effectiveness in real-world settings. That's data impossible to capture during a brief clinical visit. Similarly, patients can have continuous rhythm monitoring to detect atrial fibrillation episodes that perhaps maybe only occur intermittently. Let's look at real-time disease detection. For cardiovascular disease detection, wearables have shown genuine promise. Studies validate that devices can detect irregular heart rhythms and alert users to seek medical evaluation, as the Apple Watch's FDA-cleared ECG feature has dominated cases for detecting previously undiagnosed atrial fibrillation. Advanced wearable sensors integrated with AI support show potential for continuous monitoring and prediction of health degradation in diagnosed patients. Research from frontiers in bioengineering and biotechnology highlighted that the modern wearables can monitor heart rate variability, and electrodermal activity in clinical rehabilitation settings. Let's look at the preventive angle. It suggested that perhaps the most compelling application is preventive healthcare. The market for preventive healthcare technologies is estimated to reach $773 billion by 2034. That's up from $260.2 billion in 2024, a CAGR of 10.6%. Live monitoring of health data allows tracking of vital signs and lifestyle metrics 24 hours a day, issuing alerts to healthcare professionals before the clinical symptoms appear. Studies show this approach can reduce reliance on expensive emergency care. When wearables are integrated into decision-making in clinical practice, they promote timely prevention. According to McKinsey research, AI has the potential to save the US healthcare system up to $100 billion annually by enhancing efficiency, improving diagnostic accuracy, and supporting wellness wearables. So let's look at the right way to use wearables in a clinical setting. Research indicates wearables work best when integrated with clinical teams. Data is reviewed by healthcare providers, not just consumers. That they're focused on specific conditions, targeted monitoring of defined health issues rather than generalized wellness. That they're part of structured programs combined with education, support, and evidence-based interventions. That they're validated for specific uses. Devices have been tested and cleared for the particular application. Only 8% of wearable studies were randomized control trials. That's the gold standard for medical research. Of those control trials, 67% showed evidence of positive clinical impact. This suggests that when rigorously studied in proper clinical contexts, wearables can demonstrate real benefits. So where are these gadgets heading in medical terms? Emerging technologies include next-generation, non-invasive biochemical wearables monitoring glucose, lactate, cortisol, and volatile organic compounds from sweat, saliva, and tears. Interestingly, smart tattoos and micro needle patches for continuous biochemical parameter monitoring. Integration of wearables with electronic health records for seamless clinical documentation. AI-powered predictive algorithms that can identify health deterioration patterns before the symptoms manifest. So what's the bottom line? Wearables are transitioning from consumer wellness gadgets to legitimate medical devices. The FDA authorized 124 novel devices in 2023. That's apparently its highest annual total. But success depends on appropriate use within structured healthcare contexts, not standalone consumer applications. So as I draw to a conclusion on this rather longer podcast today, let's look at 5 solutions to the problems presented. After examining the evidence across accuracy, behavior change, market realities, privacy concerns, and clinical applications, here are 5 practical solutions for anyone considering or currently using wearable health technology. Number 1, set some realistic expectations based on the capability of the device. Let's face it, we expect medical grade accuracy from these devices to make health decisions based on what can be flawed data. So the solution is to understand what's actually being measured, particularly what is working well and what is poor. Suggested that we use it for strong, but don't obsess about it in terms of sleep. Let's treat those wearables as tools for identifying trends over time, not for precise measurement, and never make decisions based on the wearables that we're using, certainly not without consulting a doctor or a healthcare professional. Number 2, focus on behaviour patterns, not daily scores. Problem is, daily scores obsession creates anxiety and performance pressure, particularly around sleep, and that undermines surely what we're trying to overcome. The solution? Review your wearable data weekly or monthly to identify patterns rather than checking scores multiple times a day. Ask yourself, what behaviour changes have I made based on this data, and have those changes improved how I feel? If we're not taking action on the information provided, or perhaps the data is making us feel even more anxious, consider whether the device is really useful to us. Just remember, we've been monitoring our own health for thousands of years, reasonably successfully, and that's been without the use of smartwatches. Number 3, integrate wearables with professional support. The problem is wearables work best with structured programs and professional guidance, but most people use them in isolation, and that leads to high abandonment rates and minimal behaviour change. So the solution: if you have a specific health condition or goal, work with your healthcare provider or a qualified coach to interpret wearable data and create action plans. Share that relevant data with your doctor during appointments. Think about joining some structured programs that combine wearable tracking with education, community support, and professional guidance. This approach dramatically improves outcomes compared to solo use. Number 4, protect your privacy and understand data practices. This is really important in my belief. The problem is the wearable companies collect external personal health data, and most users don't understand how that data is stored, used, or shared. Let's face it, we're giving enough away just by using computers these days anyway, through the internet. So before buying one of these gadgets, read the privacy policy and understand data practices. Consider adjusting the settings to minimize unnecessary data collection. Disable any third-party sharing where possible. Choose to buy from companies that have strong privacy track records. Whether your employer or insurance company might have access to your data. And also, of course, be aware that data breaches are possible and do happen. So consider what information you're sharing. Consider whether you're comfortable with that potentially being exposed. So if privacy is a major concern, consider lower tech alternatives like basic activity trackers without cloud connectivity. Number 5, use these wearables as awareness tools, not as identity. Dependency on technology for body awareness and the risk of building identity around device metrics. I'm a 98% sleep score person, for instance. The solution is practice regular tech-free periods where you assess how you feel without checking devices. Develop something that's called interoceptive awareness, the ability to sense your body's internal state through practices like meditation and yoga, or simply taking time to check in with yourself before consulting your device. Use wearables to validate or question your self-assessment, not to replace it. Remember that you're not your recovery score, you're not your step count, or your sleep efficiency percentage. So there we are. That's today's podcast. I hope you found it interesting, and I hope it wasn't too long. As usual, take care, and I'll see you at the next podcast. Bye for now.